All right, good morning. Good morning and welcome all. Thank you for joining us for our town hall this morning. So happy to see everyone, and it's so good to get everyone on this last day of February. It's great to be here again to talk around building a healthier community on the south side of Chicago. For those that I haven't met, my name is Rashad Johnson. I have the privilege and honor of serving as the president of Advocate Trinity, as well as Advocate South Suburban Hospital. And I'm also the chair of the Southside Healthy Community Organization, or the SSHCO, as you will hear it referred to this morning and throughout our program, which we incorporated our SSHCO, dedicated to healthcare transformation and health equity for all on the south side of Chicago. I want to let you know that the session is being recorded, so a couple of housekeeping items. We want to share this with others who may not have been here and been able to attend with us this morning. And I'll also recommend that for your viewing preferences is that this town hall, you can put yourself on speaker view, and it's in the upper right-hand corner of your screen. That will be of great help for you as we discuss the topics this morning, and our upcoming board members are all speaking. Last time we got together in a town hall like this, it was in November of last year. And at that time, we shared the work that we've been working on as far as standing up our new not-for-profit organization. There's a lot of nuts and bolts and really the groundwork and the framework, the architecture, as well as the infrastructure needed to ultimately impact and have a significant impact on sustainability and improving access to healthcare and health equity within our community. And so we're working through all of those logistics. There's great beauty and power in 13 organizations and healthcare providers coming together to pull our best into making things better on the south side. But it also takes a lot to do it right, and we intend to do it right, and not only do it right, but have the biggest impact possible. We actually had over 182 participants in our last town hall, so great participation, great feedback. We started with a refresher on our model the last time we were together, and we discussed our goals over the first year. You'll hear more about the progress that we made in each of our major pillars, as well as our work that we're standing up a little later on this morning. We also heard from the Illinois Department of Healthcare and Family Services about why healthcare transformation is so important, not just on the south side of Chicago, but also across the entire state of Illinois. We introduced the members of our board of directors, comprised of one high-level leader from each of our 13 organizations that comprise our collaborative, which is made up of safety net hospitals, our federally qualified health centers, or FQHCs, our health systems, and plus we have 3 very active community members and leaders rather within our community on our board. The 17th spot for membership on our board will consist of our CEO once he or she is onboarded. And we'll have some updates in reference to where we are later on in this morning's sessions in reference to our CEO search. We also conducted an online poll, and we asked people, we asked our community members, we asked our leaders, how do they want to hear from us moving forward? And how do they want to stay informed and engaged? And it's because of the responses from that poll that we're here with you today with this town hall, as a resounding majority felt as though town halls were the best way. And then that was ranked second to following up through various emails and updates on our website as far as how you want to be engaged, how you want to be informed with our progress. So I hope you are continuing to visit our website. Just a reminder, we have regular updates that are there. We have different initiatives that we're working on and all the progress reports. And as a reminder, our website is www.southsidehealthycommunity.com. And it contains a wealth of information. So please visit it. Also, please share via email. We want to hear your responses. There's a phone number also listed on our website. And we want you to share your thoughts. We want you to be as engaged as much as possible as we shape this for. This is a transformation project that is not only for us, but it is for our entire community and is made up by the people and for the people. So we've been very busy, as you can see, since our last town hall, making progress on a variety of important initiatives that drive us toward our ultimate goal of building a healthy community and having health equity. So this morning, you'll hear from my fellow board members, and I'm excited to have them join with us this morning. Tim Egan is the president and CEO of Roseland Community Hospital. and Brenda Battle, our Senior Vice President of Community Health Transformation and Chief Diversity, Equity, and Inclusion Officer at UChicago Medicine. Both will share a number of status updates around our health equity initiatives and our model. Diane Sinclair, who's the Vice President of our Community Health Organization Development at St. Bernard Hospital, will give you some additional ways to stay informed. And she'll also share a poll question because we're looking to have you weigh in on how we can best engage around our social media channels to keep you informed and engaged. And then we'll have plenty of time for questions and answers, as I'm sure all of you are excited to ask those questions. And as always, we look forward to hearing from you this morning because it's those questions that really help shape us and how we move forward and how we deliver and execute on our mission and our vision. So please feel free to type those questions in the chat and we'll be checking that along the way. And we hope to answer as many of those as possible within the last 20 minutes of this morning's session. And if we don't get to those questions, no worries. We'll be sure to provide written response later on after this event has concluded. So if you can direct your questions in this chat to Parita Nalaswamy, she can also help compile them during our Q&A of this town hall, which will be led by another one of our board members, Dr. Erica Steed, who's the Executive Vice President and Chief Operating Officer at Sinai Chicago. And before I give the virtual floor to our other board members, I just want to give out some acknowledgements because along the way, there have been several shoulders that we've stood upon and continue to stand upon. And so I'd like to acknowledge our elected leaders, our elected officials, federal, state, and local, all have been tremendously supportive and engaged throughout this entire process. So we want to thank those leaders who are also present with us today, as I know several of you are within the audience. We would not be here without the support of our state legislators and that of our governor, who authorized the funding for healthcare transformation in Illinois. And I want to especially recognize, well, we want to especially recognize the Illinois Healthcare and Family Services for their tireless efforts and leadership to help build health equity across the state and on the south side of Chicago. So thank you, thank you, thank you sincerely. That being said, let's dive into our important updates, and I'd like to turn it over to Tim Egan.
Thank you, Richard, and good morning all. The New Roseland Community Hospital is very happy to be part of this coalition. As a safety net hospital on Chicago's south side, we see every day the significant additional challenges faced by underserved communities. We've done a lot as an individual hospital, but all of us are pulling together gives us the greatest pathway to really making a difference in the health of our patients. I want to take us back to our model for transforming healthcare on Chicago's south side. Those of you who have been with us since the beginning will recognize this model. It was formed based on the key issues that you and other members of the community raised during our community engagement process over many months, starting in September of 2020. If you are not familiar, I think my update will bring you up to speed. We've made some progress now in each of the pillars. Let's take them one by one. Number one is increasing access to primary care and dramatically improving maternal and infant health. Planning is well underway to meet our one-year target of adding 10 primary care providers to federally qualified health centers. These sites are part of the SSHCO. Those first 10 will be spread among 3 of our F2HCs, Friend Health Center, Beloved Community Wellness Center, and Chicago Family Health Center. We've already started some planning as well as to meet the year 2 target of adding another 25 primary care providers. Ultimately, every site among our 13 collaborative members with a primary care need will get additional primary care providers, up to 90 additional over the next 4 years. We are working out contracting now to make sure our F2HC partners are allocated the funds to pay and provide benefits to those new providers. These new doctors will be collaborating with care coordinators and other care team members to comprehensively address the needs of the most clinically complex and socially vulnerable patients and residents of the South Side, including patients facing chronic illness and behavioral health needs. Our work group, which include clinical leaders spanning across the coalition, are also in active meetings to design care models meant to address maternal and infant health. More on that to come. It's very exciting to see some of the things we've been talking about and really hoping for taking to start. They're starting to take shape. While we all want to do everything at once, that's simply not possible. Smart, steady progress is the key to a sustainable plan. In terms of access to specialists, clinical leaders from across the coalition are working together to develop care models that will better address the needs of patients with hypertension, with behavioral health needs, and with substance abuse disorders. The board has agreed to prioritize behavioral health first because there is a high need and a severe lack of resources for these important services. We are working to get more mental health practitioners in our model as quickly as possible, well before the end of the year. Specifically, we are developing plans to begin recruiting 15 new behavioral health professionals, including psychiatrists, psychologists, psychiatric nurses, and licensed clinical social workers to serve the South Side. We don't underestimate the difficulty of this. Behavioral health workers are in very short supply, but we know how critically important this is for our community. And it was an issue that was continuously raised by all of you as we compiled our proposal. So we're making it an early priority. We are also reviewing the additional critical needs of our patient population, like hypertension, preventive care, and maternal health. We hope to have more to share on that front in the coming months. Planning is underway to support the recruitment of additional 80 community health workers and nurse care coordinators. This is just year one to target. These positions will provide a very critical connections to the community that enhance care delivery and better outcomes. This direct level support and navigation can break through what sometimes feels like a lot of red tape and confusion and provide a level of calm, control, coordination, especially for patients with complex clinical and social needs. Community health workers are individuals from our community who are trained to help patients find the care they need and navigate the healthcare system. Nurse care coordinators are similar, but they are additionally clinically trained to help patients manage medications and follow treatment plans recommended by their doctors. When we talk about a care team, this is what we mean, that there is an entire team of people supporting doctors to make sure that patients have every support they need to stay or get healthy. These new care member teams will be deployed across safety nets and FQHC sites in our collaborative, looking at all of the needs of patients and coordinating support among primary care, specialists, and behavioral care. They will also screen for social service needs. Based on our coalition's partners' expertise in specific areas of care coordination, UChicago Medicine was selected by the SSHCO to hire licensed care coordinators on behalf of the organization. And Sinai Urban Health Institute was chosen to hire community health workers. These two groups of hires will work closely together across our sites of care. Now we get into data and tech. The fourth pillar is how all of this gets connected together. We have a lot going on in this area. Imagine, with 13 different healthcare organizations as part of our coalition, how many different technology solutions we all use. Our technology workstream team did an inventory of all 13 coalition members' technology systems and learned that we are using at least 5 different electronic health record tools. So that indeed is a challenge. We are also holding sessions with clinical leaders from every organization to think through all the technology needs for our new interconnected model. We are thinking through all the basics, like who on the SSHCO care team needs to talk to whom, how often, how and when, as well as the security measures that will need to be in place to protect privacy. We know that fully connected care is critical. So, with all this information, we have started a process of reaching out to more than 25 potential software vendors to see if they have solutions that might fit the needs of our SSHCO network. It's a tall order, but we believe we will find the right solution. Now I'm going to ask coalition partner and board member Brenda Battle with UChicago Medicine to share some additional updates on progress we are making. Brenda?
Let me unmute. Okay. Great. Thank you, Tim. I'm Brenda Battle. I'm the Senior Vice President for Community Health Transformation and Chief Diversity and Equity Inclusion Officer for UChicago Medicine, and I serve as the Treasurer of the Board for the SSHCO. I'd like to first share that I am really excited that UChicago Medicine is a part of this important groundbreaking collaborative. It's truly encouraging to see meaningful investment and a coordinated and collaborative effort toward improving the health of residents on the South Side of Chicago. The SSHCO has a work group dedicated solely to the social determinants of health. Issues like lack of nutritious food, housing, job opportunities, transportation, and more. Our work group put together a request for information, or an RFI, that was sent to a broad list of community organizations on the South Side and those who provide services to South Side organizations and residents. We held 2 well-attended question and answer sessions to support this process, giving anyone who might want to respond a chance to more fully understand our potential needs and the information we were looking for. We were really pleased that we received 42 responses to this RFI from a variety of community organizations who provide a number of services that could help support our patients and improve their health. It is great to see so much participation from the community and so much opportunity to potentially partner to support critical needs. We have built a database of these resources, and as we identify key needs that we are ready to act upon, we will draft requests for proposals, or RFPs, centered on those needs. Let me give you an example of how this might work. Let's say we determine that we need to move more quickly on maternal health and infant mortality. To have the best support possible for a healthy outcome for mother and baby, that means a lot of regular doctor's visits, 6 to 10 on average. We may need transportation resources to make it easier for mothers to get those important appointments, And so we might put out an RFP for transportation services to partner with us. This is just an example, but you can see that having some of these resources already identified could make things a lot smoother. The deadline for submittal was February 4th, but we remain interested in additional ideas or resources we may be able to draw from. If your organization might play a role or be a potential partner based on the services you provide, we have left the link up on our website at www.southsidehealthycommunity.com. So you can fill out the brief survey and be a part of our potential resources database. Next, I want to update you on the CEO search. We stood up this new not-for-profit, the SSHCO, and our board members and many work groups have been very active. But we really need a CEO, a chief executive officer, to oversee the whole operation. We're working with a minority-owned executive search firm, the Exeter Group, who helped us to develop the qualifications and posted the job opportunity on several professional sites. And it's also posted on our website. We received a good number of applications from highly qualified candidates and have completed a first round of interviews. These candidates run hospitals, head up managed care organizations, and manage not-for-profits. There's a lot of interest in this role. We expect to do a next round of interviews in March and hope to announce our new CEO in April, so stay tuned. Working with Exeter is one great example of our focus on minority vendors and partners. Another minority-owned business we're working with is our legal counsel, Grant Law Firm. In addition, we have recently engaged a fiscal agent, Benford Brown and Associates, to essentially operate as our chief financial officer. BB&A is a minority woman-owned CPA firm that is supporting our work with budgets, taxes, payroll, auditing, and more. They will be reporting to the board monthly and are creating policies and procedures to ensure that we are good stewards of the funds entrusted to us by the state. And we selected a bank for the SSHCO. Many of you may bank with them, Providence Bank and Trust at State and 79th Streets. They are very committed to community service and stewardship. And in fact, they promise that 10% of the bank's profits are donated to local, civic, non-for-profit, and faith-based organizations. In their 18 years in business, they have donated more than $6 million to community organizations who make neighborhoods better. We really like their mission of investing in communities and neighborhood improvement, and feel it aligns very well with our mission to improve the health of residents throughout Chicago South Side. So those are the highlights of the progress we've been making over the last quarter. It is exciting to see these things start to take shape. A quick reminder, please put your questions in the chat. You can find the chat button at the bottom of your Zoom screen. Please direct those questions to Parita Nalaswamy in the chat, and she will make sure we respond to them. Now I'm going to turn the virtual microphone over to my coalition colleague and fellow SSHCO board member, Diane Sinclair with St. Bernard Hospital, who will tell you more about how to stay informed and engage with the SSHCO.
Thank you, Brenda. Good morning, everyone. We've really tried to make sure that we keep you informed on the process, progress, and the milestones that we've achieved as we work to improve health equity in our communities. My name is Diane Sinclair, and I'm the Vice President of Organizational and Community Development for St. Bernard Hospital, a safety net hospital in Englewood on Chicago's South Side. I want to take a little time to update you on the many ways that you can continue to stay connected and informed on the progress we are making, improving health equity on the South Side of Chicago. You could get regular updates and stay informed, as well as share this information with your neighbors and networks using several platforms. As many of my colleagues have shared previously, you can always visit our website at www.southsidehealthycommunity.com. That's www.southsidehealthycommunity.com. There you will find our history, reports on community input and engagement since the fall of 2020, the latest updates, postings, news, and opportunities around the Southside Healthy Community Organization. In addition to our website, we now have social media platforms with frequent postings with which we hope you will engage and share with your own network. Please follow us. Please follow our Facebook page at SS Healthy Community, where you will see regular updates, including our progress, news around health disparities, health tips, or board members, and more. We ask you to share this page with your friends and neighbors on the South Side and encourage them to share it as well. You can also follow us on LinkedIn by searching Southside Healthy Community Organization, where we will share updates of our mission, resource needs, the status of the transformation model, job opportunities, and more. And since we're here talking about it, why don't we take a few minutes right now? I'm going to ask each of you to go to your Facebook page, search SS Healthy Community. And when our page pops up, I'm going to ask you to become a follower of our page. And I'll wait a few minutes for you to do that. And then once you've done doing that, I ask you to search us on LinkedIn and do the same. And again, on LinkedIn, we are searching for Southside Healthy Community Organization. As our organization further engages with social media, we would like to know which social media platforms you use most for information about healthcare, healthy living, or just to keep updated on news. You should see a poll, a Zoom poll pop up on your screen soon. I'm going to ask you to select the top 2 social media channels that you engage with most often. Among the choices are Facebook, LinkedIn, Instagram, Twitter, YouTube. You may click 2 options. And if you do not engage with social media, that option is also available. So I'm going to give you a moment to complete the poll. So it appears that the results of the poll, it appears that Facebook and LinkedIn are the top two options. And we have, as I've said previously, we have Facebook and LinkedIn pages. So please like us, join us, follow us so that you could keep abreast of what we're doing, and we will continue to push out information. Thank you for participating. So critical to our goal of building access to more healthy resources on the South Side of Chicago is being transparent and fully engaged with our residents. We would like to connect with the South Side's network of block clubs. And this is to support our dedicated effort to reach all of our residents and as much people as possible. So we want to keep everyone, not just the leaders that participate on these calls, connected with what we're doing to address health equity, while engaging them to become involved and to share more information with their neighbors and their own networks. If you are involved in a local block club, or you know people who are, we're going to ask you to share that information with us. You could either put the information in the chat, or you could contact us by sending us an email at southsidehealthycommunity@gmail.com. I'll say that again. You could send us an email at southsidehealthycommunity@gmail.com and tell us how we can connect with the Southside network of block clubs. Finally, on Saturday, March 12th at about 1 p.m., a couple of our SSHCO leaders will be on WVON AM 1690 radio on the Community Health Focus Hour. We encourage you to share this with your neighbors and other members of the community that are not able to join us today. The leaders will talk about our work to date, and they'll take questions from listeners. You will receive more information and reminders about this interview as we get closer to that date. Again, I want to thank everyone for joining us today and being part of this movement as we aim to transform and improve health equity on the South Side of Chicago. I will now turn it over to Dr. Erica Steed from Sinai Chicago, another board member of the SSHCO, who will open up our session to questions that you may have been putting in the chat. And if you haven't, you still have time to submit those questions. Thank you. Erica, over to you.
Thank you, Diane. So as Diane noted, my name is Dr. Erica Steed. I serve as the Executive Vice President and Chief Operating Officer of Sinai Chicago, which includes Holy Cross Hospital, Mount Sinai Hospital, Schwab Rehabilitation Hospital, as well as a wealth of other care entities across Sinai Chicago. Holy Cross Hospital is proud to be a member of the Southside HCO and part of Sinai's safety net health system, which also includes Sinai Urban Health Institute, as well as Sinai Community Institute, and our network of community clinics run by Sinai Medical Group. Sinai's mission for over a century has centered on the idea of health equity, that everyone is entitled to high quality care, no matter where they live or their ability to pay. I know many of you have a number of questions, so working with Parita and the rest of our panelists, we're going to do our best to provide some answers to what we're doing and what that means for our communities. And just so you know, this gives me an opportunity to have my Oprah Winfrey moment and facilitate us through a Q&A dialogue. So Parita, please pull up the questions that have been entered in the chat so far, and we will start to begin answering them.
Dr. Steed, can you see my screen?
I can. Thank you. So the first question is, has the Southside Healthy Community Organization started to receive funds? So I'm going to give that question over to the panelist, Tim Egan, to start off by answering that question.
The answer is yes. We began receiving funds from the state at the end of January 2022.
Perfect. Thank you, Tim. The second question that actually came up along those same lines is, how is the Southside Healthy Community Organization allocating those funds? I'm going to have my colleague Rashard Johnson answer that question.
Thank you, Dr. Steed. Our year one funds will be focused on meeting our year one deliverables that we outlined and committed to with HFS. And so these include adding 10 primary care providers to our FQHC sites that are part of the SSHCO. Also, those first 10 will be spread among 3 of our FQHC partners, Friend Health Center, Beloved Community Wellness Center, and Chicago Family Center, Chicago Family Health Center. In addition, we'll also be hiring 80 community healthcare workers and nurse care coordinators in the first year. And then finally, we anticipate that we will spend some of our funds and those budgetary funds on the technology work that's going to help build that communication support between the new providers and really interconnect us in a way that is palpable and that we can utilize our care management staff.
Thank you, Rashard. The next question stems around job opportunities and specifically communication around that. Brenda, can you answer our question on how will the SSHCO communicate open job opportunities?
Thanks, Erica. So all of the future job opportunities will be communicated through emails and social media, and all of the job opportunities will also be on our website.
Thank you, Brenda. The next question really talks about a key update around expanding access to primary care. So Tim Egan, when specifically will the new primary care providers be in place and the other new caregivers that we actually spoke of?
So as per our proposal, we're targeting hiring our first group of community health workers as soon as June 2022. We are targeting the fall to begin onboarding our first group of primary care providers and some specialists, including psychiatrists and other mental health professionals.
Thanks, Tim. The next question really talks about how will the community at large know when there's more access? So Diane, can you answer the question on how will we know when there's more access, and when specifically will the community start to feel the impact of the changes that we're making?
So as we go through the process, we will be constantly communicating with the community through the channels that I mentioned. We will not be able to start communicating until we have started to hire practitioners. So we will hire practitioners, we will communicate that out, we will give them some time to work. And then as we start to collect the metrics, then we'll be able to communicate and tell our community when we're starting to make progress. But that cannot happen until we start to actually do the work. And that starts with hiring practitioners that we've spoken about earlier.
Thanks, Diane. So along those same lines, around hiring specifically, Brenda, can you answer the question on, will the Southside Healthy Community Organization, will we make a specific promise to hire community health workers only from the South Side? And then what are the specific qualifications for the position?
So our goal is to hire from the South Side, and we're going to try our best to hire community health workers that are from our community, that represents the individuals in our community. That's our primary goal. We see this as a workforce opportunity for the South Side. The qualifications are going to be posted with the job openings and the job descriptions very soon, actually, on the digital channels that Diane talked about and we spoke about earlier, as well as on other job sites.
Thanks, Brenda. So I'm going to take the questions in a different direction, specifically when we are fully launched. What specifically are we doing to protect the privacy of the health records of the population that we serve? Rashard, can you take a stab at that question?
Absolutely. And I can appreciate this question because privacy and security is extremely important. Now, keep in mind, our SSHCO is composed of 13 healthcare organizations and providers who are working with protected health information every single day. And so as we develop our new technology, and that allows for our organizations to communicate amongst each other, we've engaged with an attorney that specializes in privacy and security to really help us understand what the needs are and the boundaries, the standards and restrictions that we have to have in place to ensure that we protect the privacy of information at all costs. And so we understand that this is an important issue, but we will continue to work to develop our strategies around these protocols and these technologies that our 13 healthcare organizations are working through every day.
Thanks, Rashard. So Diane, this specifically pulls on your heartstrings on community engagement. We've talked before about having a community advisory council. Can you speak specifically to where that stands, and then go into a little bit more detail on how others can get involved on the community advisory council and how we're going to make decisions around engagement and participation?
Okay, thank you. First of all, yes, we have been talking about a community advisory council, and it is very important. But we thought the best thing to do is to delay the start of the community advisory council until we hire a CEO. See, the board of directors has kind of stepped in the interim to keep things going, but the board is to focus on policy, not to get involved in operations. And we also think that this would be the perfect opportunity for this new CEO to really get connected with the community. So the community advisory council, we will start recruiting after we have hired the CEO. We will continue to use, the CEO will engage the community, and we will continue to use the channels I talked about to let everybody know when we are ready to recruit members for the Community Advisory Council. We will let them know what the criteria is. We intend to be extremely transparent about this process. And again, the goal of having a Community Advisory Committee is to ensure that we continue to stay connected and that we have a clear path to constantly get the feedback and input of the residents that we serve. I hope that answers your question.
Thanks, Diane. So I'm going to go back further into diving into the community health worker position a bit. So Brenda, can you go into a little bit more detail on the training requirements for CHWs, and specifically, will the residents from the neighborhood communities be trained for the CHW positions, or is it a requirement that individuals already be trained coming through the door?
That's a great question. We're actually going to hire both. We're going to hire community health workers that are already trained. As you know, Sinai Urban Health Institute has a long-standing record of hiring community health workers from many communities. So we're going to hire individuals that have been trained, but we're also going to train individuals to be community health workers, which is why we've contracted with Sinai to help the SSHCO with that. However, everyone will undergo training on the HCO policies, the SSHCO policies. So even if you come in trained, or if you are trained, you're going to have to be trained in the policies and practices and procedures of the SSHCO, which is very much aligned with the care model that's been designed for the SSHCO.
Thanks, Brenda. Staying on the topic on CHWs, Rashard, I'm going to throw a question over to you. How will our collaborative ensure a fair worker wage for the CHWs?
Yeah, fair worker wages is extremely important for our collaborative. And not only that, when we think about it, we look at the social determinants of health, and we know that a fair worker wage is, quite frankly, important for us to live a healthier lifestyle, also have access to healthcare, et cetera. And so we've extensively done our due diligence on the wage rates of not only our CHWs, but our other providers on the south side of Chicago, and ensuring that with this collaborative, we can offer a fair healthcare and fair worker wage moving forward. Great question. And not only that, we want representation as well from our community, as we talked about earlier within this town hall. So it's extremely important for us, and in an area that we've had our focus and our eye on from the very beginning.
Thanks, Richard. I'm going to actually jump down to the last question that actually pulled up on the screen, just because I want to make sure that we cover this. We didn't hear anything specifically about behavioral health, and will these services be covered as well for the community? So Tim, can you take a stab at answering that question?
Sure, and I know I moved fast during my presentation, but I can assure you that our focus here with this organization is hyper focused on behavioral health. I mentioned that we're developing plans to begin recruiting 15 new behavioral health professionals, including psychiatrists, psychologists, psychiatric nurses, and licensed clinical social workers to serve the South Side of Chicago. So we are absolutely hyper focused on behavioral health. And we know that this is difficult because behavioral health workers are in very short supply. But I can assure this group, this organization is hyper focused on behavioral health.
Thank you, Tim. Diane, I'm going to throw a question over to you. Can you go into a little bit more context on what the geographic area is that we're working with the Southside Healthy Community Organizations? And we did get into community-based organizations, but what other CBOs and or faith-based organizations are we specifically working with to target these families in need, particularly ensuring that their social determinants of health needs are being met? Diane, can you take a stab at that?
That's quite a few questions in one, Dr. Steed. So I will start out by saying that we actually have a work group that's focused on the social determinants of health. So we have a subgroup made up with representatives from all the organizations that are focused specifically on this topic because we think that this is critical to the success of all the work that we do. I can't specifically mention the name of the organization, but I will say that we have created an extensive database of people and organizations, faith groups, community-based organizations who from day one have been saying, we are interested, we want to be at the table. And so when the right time comes for us to start activating that work, understand that we will be reaching out to these people. And if you are part of an organization, a faith group that wants to get involved, again, you need to go to our website, send us that information. So as Brenda talked about earlier, you can be part of our resources that we could build on going forward. So as about the geographic area, it is quite huge, right? I think we have, and correct me if I'm wrong, we intend to hopefully reach about 400,000 people. So this is from as far west as Holy Cross, as far east as South Shore, and starting from I think around 20-something street and going as far south as the city limits. So that should show you that we have taken on a mammoth task, but I think with the 13 organizations at the table who are committed to this, there is very little that we cannot achieve. But again, to go back to my question, it will be dependent on engaging many of our CBOs and faith-based organizations whom our community has strong trust with and being your partner. So again, if you are not yet involved and if you're interested, please go to our website and submit your information. Thanks.
Thanks, Diane. You handled that wonderfully. We actually have an additional question in reference to behavioral health. So I'm going to actually ask two questions in one, Tim, following the trend that I'm setting. So specifically, will LCPCs be hired to assist with behavioral health? That's the first question. And then regarding behavioral health services, will there be an opportunity to open up more inpatient behavioral health sites and residential facilities for our community members, or is this out of scope for the SSHCO? So Tim, if you can start with the answer to that.
Sure. So to answer the first question about LCPCs, absolutely. This is part of the group of new behavioral health professionals we are attempting to recruit right now. In terms of the expansion of inpatient behavioral health sites, just a plug for the new Roseland Community Hospital, something that's been near and dear to my heart and I've worked on for over 4 years. We have our own transformation grant that's pending with the state, with HFS. that would expand our adult behavioral health inpatient volume from 24 beds to 50 beds. So that's the beauty of this in terms of expanding inpatient behavioral health sites and residential facilities. This is all about coordinating care amongst the 13 providers that are looking to expand all behavioral health services. So I can give you the rifle shot focus at the new Roseland Community Hospital. We have absolute detailed plans that have been submitted to the state and HFS to expand inpatient behavioral health and create what we're calling sustainable healing centers for adolescents, which would be residential facilities.
Thanks, Tim. Parita, do you mind scrolling up? Because there was a question specific to the RFP process that I want to make sure that we actually cover. Brenda, can you take a stab at this one? If the organization completed in the RFP, when will it be expected that there will be a follow-up on the progress?
Okay, so I want to clarify where we are. Our initial process was to ask for requests for information, and we've done that process. And from that process, it's providing us insight into what types of services CBOs are offering and how we can leverage that work against our care model design. So at the point in which we determine which program initiative we're going to execute on in order first, second, third, then we will actually issue an RFP for individuals to submit a proposal to us. And from that proposal, we'll select community-based organizations to serve that particular need. And just to say, there are going to be a lot of needs over, the lifetime of this work that we're doing. So where we start, we'll continue to add to that. And so we don't have the date for when our first RFP will be issued, but when it is issued, it will be issued with a timeline for proposal submittal and a timeline for award of the award or the grant for the proposal.
Thanks, Brenda. So behavioral health seems to be a hot button, and we want to make sure that we address this one. So Tim, going along the lines that you've already set here, this is a twofold question again. Does behavioral health include services, diagnostics, and support for dementia-related conditions? We are significantly underserved in this particular area, so if you can elaborate on that. And a second part to that question is there any room to work with the other community health partners to meet the needs of behavioral health, which is vast on the South Side with very limited resources?
So we know, all of us know the challenges on the South Side of Chicago, where Roseland Community Hospital is a small, economically challenged safety net hospital with not a lot of resources. We have basic diagnostic screening tests. That's the beauty of the SSHCO, is that we're all coming together in this collaborative so we can share these resources amongst the group of patients that we're coordinating care on the South Side of Chicago. So yes, does diagnostic service going to improve for dementia-related conditions? Yes. Are they going to improve for all related conditions in behavioral health? Absolutely. And is there room to meet with the other community health partners? The beauty of care coordination is we're trying to get the patients that we serve into the systems that serve them best and create the best path of healthcare that is possible on the South Side of Chicago. And it's this 13 partners and beyond.
Thanks, Tim. Richard, I'm gonna turn a question over to you. So the Southside Healthy Community Organization noted in its application an estimated perinatal workforce shortage of at least 60 CFEs in this region. How many midwives does the SSHCO plan to hire, and in what time frame does that look like?
So great question. One of the things that we know is a key pillar for us is in reference to our maternal and infant health on the South Side of Chicago and filling those gaps. And so the SSHCO has come together and we've identified, the OB care that's needed here. And not only that, but the nurse practitioners as well. So the advanced practitioners to fill those gaps that are necessary. When we look at year one, and we talked around our primary care gaps. There were about 10 providers that's there, and that consists of not only our primary care, but then also OB providers as well as our nurse practitioners that are there. So we're still in the process of reviewing that data and looking at where we have the largest disparities that are there. We haven't gone down to the midwifery component of it, but we know that for us, the main thing is to ensure that we have our providers that are there that can provide those prenatal visits that are necessary, and then the follow-up for deliveries that are necessary for our community. And so our OB, allocating our OB docs and then allocating our advanced practitioners is going to be key for us moving forward as we go into year 1 and then year 2.
Thank you, Richard. Diane, I'm going to throw a question your way. So when the various healthcare providers are hired, will they be working at the various organizations? Can you provide a little bit more detail on just the process of how the providers are going to be allocated?
Thank you, Dr. Steed. So we are going through an extensive process of not just putting people anywhere. I am so sorry. So my apologies. So we are going through an extensive process to decide where we will place providers. We're not just going to place them places just because an institution says I need one. What we are doing is we're looking at the data, we're looking at where the needs are, where service gaps are, and then we're going to place them where the gaps are largest. So the goal is to ensure that the neighborhood that needs the most or has the largest gap in primary care needs, that's where the priority will be. The community that has more, let's say, behavioral health practitioners, since we're talking about that, they will not be at the top of the list. We are going to deal with the people that have the gaps first. So the goal is to, as we talk about health equity, it's about placing it where the needs are greatest so that those who have the least can at least come up to par with where everyone else is. I hope that answers your question.
Thanks, Diane. Brenda, can you go into a little bit more detail about the hiring requirements for the CHW and care coordination role, if you can just provide a little bit more clarity on that. So will we be hiring licensed social workers as well to function in the CHW role?
So our intention is to hire paraprofessionals for the CHW role, but we will be hiring licensed social workers as well. And the CHWs, the licensed social workers, the nurse care coordinators, they will all function in that space of care coordination. They will have different functions, but they will all be a part of the care coordination team. So the paraprofessional community health worker will work alongside with the social worker and the nurse care coordinators, and they will all function in those roles of care coordination. So our model has really put these 3 roles together under that function.
Thank you, Brenda. So I think we have 5 minutes remaining. So I'm gonna ask one more question that's actually on the screen, and I'm actually gonna do a 2-for-1. So Richard, Mr. President, if you can wrap up with the last question on, will we have an opportunity to open up opportunities to be a board member? So if you can answer that question and then conclude with, will the slides and recordings from this session actually be shared?
Yeah, absolutely. Any time that is addressed, Mr. President, I know there's a hook to the question. But as far as our board members are concerned, as we've shared earlier, it consists of our 13 founding collaborative organization and a board member from each of those high-ranking organizations, and then as well as 3 of our community leaders, community members on the board, and then the final spot, this 17th spot, is for our CEO once she or he comes on board. And so, per our bylaws, that's the structure for our board composition at this particular moment. We don't anticipate opening that structure up to other organizations that are coming in for the board, but there are opportunities as we go and we look at in terms of just the committee that's going to be formed and the community committee that's an advisory to the board, and opportunities that are there that we look forward to collaborating on moving forward. So we'll have, we have terms that are there, year terms, as far as how we are on our executive committee on our board, and a couple year terms for members that'll be rotating amongst those organizations. And then I believe the final question was, are we sharing the slides and are we sharing this recording? That's part of the reason why we recorded. Absolutely, yes. We'll be sharing this information, and we hope to share it with those who weren't able to join. But then for those of you who did join, we want to thank you for this opportunity, and it will also be posted on our website as well. We'll have that information that's there.
Thank you.
Thank you, Dr. Steve.
Thank you, Richard, for your closing remarks. So I just wanted to, along with my colleagues, I wanted to thank each and every one of you for being here this morning, for staying engaged and staying in tuned and involved as we work to build health equity on Chicago's South Side. So please take a moment to visit our website occasionally, like and share our social channels. And we hope to see you next quarter, sometime in late May, for our next town hall. I wish everyone a blessed and wonderful remainder of your week. So thank you so much.